Hello everyone, and welcome. I'm glad you're here today to explore an important and often overlooked issue. Today, we'll be discussing understanding the harm, focusing on the topic of breast ironing. This is day 2 of our 3-day series. On this first slide, I want to set the stage for what we'll cover. We'll look at the public health perspective, the lifelong effects, the long-term impacts, and the short-term harm caused by breast ironing. We'll also examine the broader consequences of this practice. I'm excited to take you through this vital information, so let's get started. It is a form of violence that has real, measurable health consequences. This is not just a painful tradition or something harmless. It impacts development, social interactions, mental health, and physical well-being. And importantly, its effects are not temporary. They can last a lifetime. Breast ironing is still happening today, which is why understanding this issue is so crucial. This slide really highlights the harsh reality of what this practice entails and why we need to address it. In this slide, I want to highlight the importance of photojournalistic documentation when it comes to medical care in developing regions. These images often tell powerful stories about the challenges faced by communities there. You'll notice that the practice of repeated trauma over weeks or months can significantly increase the risk of tissue damage. For example, ongoing injuries can lead to symptoms like fever, local infections, open wounds, hematomas, swelling, and inflammation. We also see burns of all degrees, first, second, and third degree, which can be especially severe. Along with these physical injuries, severe pain is a common and distressing symptom reported by those affected. Focusing on a specific issue, breast ironing, which typically occurs during early puberty, is a critical concern. This period is vital for hormonal and tissue development, so any injury or trauma during this time can have lasting physical consequences. Overall, the immediate physical harm caused by these practices can lead to serious physical consequences, emphasizing why thorough documentation is so crucial to understanding and addressing these issues. Let's talk about some of the long-term concerns related to breast procedures. One major issue is the delayed detection of future breast pathology. When extensive scarring occurs, it can make it harder to identify abnormalities early on, which is critical for effective treatment. Damage to the developing glandular tissue is another concern. If this tissue is compromised, it could potentially impair milk production later in life, affecting breastfeeding capabilities. Persistent pain is also a significant issue. Some patients experience ongoing discomfort, which can sometimes interfere with lactation. This chronic pain can be quite disabling and impact quality of life. Additionally, scar tissue formation can lead to cyst development and fibrosis, both of which can cause further complications. Over time, these changes may result in permanent breast deformity and asymmetry due to tissue damage. Because the breast comprises glandular, connective, and vascular tissues, repeated exposure to compression and heat during procedures can contribute to long-term physical complications. These may include persistent deformities and other physical consequences that affect the breast's appearance and function over time. So, overall, while these procedures can be beneficial, it's important to be aware of these potential long-term issues that could impact both the physical health and the aesthetic outcome of the breast. When we look at this from a developmental perspective, it's important to understand that what might seem like just a physical injury is actually much more than that. It's an interruption of healthy maturation, which can have lasting effects. For example, experiences that threaten a sense of safety or emotional regulation can really disrupt how a young person learns to trust their caregivers and develop a sense of body autonomy. Trauma during this critical stage can interfere with key developmental milestones, such as consolidating a positive body image, forming a clear sense of identity, and navigating rapid neurological development. These are all foundational for healthy growth and self-understanding. Specifically, during adolescence, we see a period where development is especially impactful. Take breast ironing, for instance. This harmful practice occurs during adolescence, a time when the body and mind are undergoing significant changes. It's a period marked by intense developmental implications and impacts, affecting not only physical health, but also self-perception and identity. And if we think about it through the lens of documentary photography, we see how adolescence is a critical time for identity formation. Images from this stage can powerfully illustrate how young people navigate their evolving selves amidst complex social and cultural pressures. Understanding these connections helps us appreciate the profound importance of supporting healthy development during these formative years. This slide focuses on the long-term emotional impact that breast ironing can have on girls. It's important to understand that the trauma doesn't just fade away after the procedure. In fact, it can lead to deep emotional distress that persists well into adulthood. Often, the way this practice is justified, by saying it's for their own good, can cause girls to internalize blame for their own suffering. They might grow up feeling responsible for what happened to them, which can be incredibly damaging to their self-esteem and sense of worth. We also see how this isolation can develop. Girls may be cut off from their peers and support systems, leading to social withdrawal, especially around puberty when body image becomes such a sensitive issue. The feelings of shame and betrayal by trusted caregivers, who are supposed to protect and nurture them, only deepen this sense of betrayal and trauma. This combination of ongoing pain, repeated procedures, and the emotional betrayal creates a cycle of fear and anticipation of future trauma. Girls subjected to breast ironing often report significant psychological trauma and a lasting psychological impact that can affect their confidence, mental health, and overall well-being. Ultimately, these emotional scars highlight the profound and lasting harm caused by this practice, emphasizing why it's crucial to address and prevent it. Silence plays a significant role in increasing feelings of isolation and making it harder for girls to access the support and healing resources they need. When they're silent about their experiences, it not only keeps them trapped in their pain, but also helps the secrecy surrounding their situation grow stronger. This secrecy can actually make the harm worse because girls are often discouraged from speaking out or sharing what they're going through. This silence and secrecy can lead to a range of challenges in their relationships, making intimacy difficult and creating relationship difficulties overall. It also impacts how they see themselves, sometimes leading to distorted body image and self-perception, which is often linked to body dysmorphia. Trauma responses can also emerge, such as PTSD-like symptoms, flashbacks, and persistent feelings of sadness or hopelessness, which are signs of depression. Many girls also experience persistent worry, hypervigilance, and chronic anxiety, all of which are signs of ongoing trauma and distress. Although research is still limited, we do understand that the long-term psychological effects of these experiences could include serious mental health risks. These might manifest as ongoing mental health challenges that impact their overall well-being well into the future. All of these points highlight how critical it is to break the silence, provide support, and address the complex, long-lasting impacts of trauma. When girls associate puberty with punishment, it can really distort their healthy sexual development. This kind of negative association can stick with them and impact how they view their bodies throughout life. It's a critical concern because it influences their engagement with sexual health information and their overall confidence. When girls have these negative feelings, it can also affect their participation in social activities, like sports and exercise. For example, if they experience pain, infections, or recovery issues, they might be less likely to stay physically active. That, in turn, can lead to decreased school attendance and social engagement. One specific issue to highlight is breast ironing, which can have serious consequences beyond just physical health. It can impact a girl's social and educational opportunities, affecting her confidence and participation in school and community activities. Overall, these issues don't just stay on a physical level. They ripple out into many areas of a girl's life, affecting her social development, educational progress, and long-term well-being. This slide highlights a critical challenge we face when addressing harmful practices like breast ironing. Because these acts are often hidden, they tend to be underestimated in national data, which means our policy responses can be inadequate or even misdirected. One of the most troubling aspects is that the person causing harm is often the same individual providing care, usually a mother, creating a very difficult dilemma for the child. This dynamic makes it hard for girls to seek help or disclose what's happening, especially since they often have no safe reporting pathway. Furthermore, breast ironing isn't always recognized as a specific form of harm. It gets misclassified within health systems, sometimes dismissed as a cultural practice or normalized within communities. This normalization minimizes the severity and obscures the true extent of the issue. Girls are often afraid of the consequences if they disclose what's happening, which leads to underreporting. Most of these acts occur within the home, away from external observers, and are conducted privately. This secretive nature makes it one of the greatest challenges we face. Breast ironing is simply hidden from view. All of these factors combined create a significant data challenge. If we can't see or properly recognize these acts, it's incredibly difficult to understand the scope of the problem or develop effective strategies to combat it. This underscores the importance of awareness, better reporting mechanisms, and culturally sensitive interventions. Cultural myths continue to drive harm, and it's important to understand that these beliefs can have real, negative consequences. Field reports and advocacy groups are actively documenting cases where misinformation about puberty and sexual violence still persists. This isn't just a problem affecting one generation. People of all ages are impacted, and we shouldn't dismiss these issues as exaggerated or outdated either. The reality is that these myths are alive and well today, affecting how communities understand and respond to these critical issues. So, it's essential that we recognize this ongoing challenge and work together to dispel these harmful myths, ultimately creating a safer and more informed environment for everyone. Without data, the harm caused by this practice remains invisible, which makes it very difficult to address effectively. So, one of the key questions is, are we actually funding research in the regions where this happens most? Understanding the prevalence is crucial if we want to make a meaningful impact. Moving on, we need to ask whether our child protection policies explicitly address this specific practice. Are they clear enough to guide action and prevent harm? Healthcare workers also play a vital role. They need to be trained to recognize both the physical and psychological signs that could indicate this practice has taken place. It's important that health professionals can identify these indicators early. Additionally, we should consider whether adolescent health screenings are designed to catch signs of breast ironing or related issues. These screenings can be a vital window for intervention. If we start framing this as a public health issue, several key questions come into focus. How do we ensure that all these areas, research, policy, healthcare training, and screenings, are integrated and effective? And finally, it calls for professional reflection and a collective call to action, because addressing this requires awareness, commitment, and coordinated effort across sectors. Now, on day 3, we're focusing on solutions. We've already looked at day 2, where we discussed the consequences of current practices, and day 1, where we explored understanding the practice itself. The key question we're asking today is, how do we replace fear-based practices with evidence-based protection methods? This is crucial because moving away from fear-driven approaches requires us to adopt prevention strategies, develop effective policies, and engage in advocacy. Prevention is about proactively creating safe environments. Policies provide the framework and accountability, and advocacy helps drive the change we need. Looking ahead to tomorrow, we'll focus on how to implement these solutions effectively. Remember, the goal is to shift from reactive, fear-based responses to proactive, informed practices that truly protect and support those we serve. This is the pathway to creating lasting, positive change in our fields.